I'm Mrs. J for Absolute Medical Coding Institute, or AMCI, in partnership with AAPC. Hello, coders. This month's discussion will be on cardiovascular's percutaneous coronary intervention, or PCI. Now you notice I said cardiovasculars apostrophe S because it is a cardiovascular procedure. However, this cardiovascular procedure is located in the AMA CPT medicine section. All right, so just to give you a little bit of a background of PCI. When you're coding these PCIs, you're coding them to treat occlusive disease of the heart. So pretty much if there's blockage in the heart, you will code these PCIs. Doctors will carry out these procedures. We're going to learn a little more about how these procedures are done. If you are in the class, you will see an animated demonstration. If you're not in the class, I will summarize it for you. Okay, coders, let's get started. Coders, did you like that presentation? I know I did. I know I learned a lot. All right, so we've coded PCI, or percutaneous coronary interventions, earlier. We coded it with aneurysms and even coding vascular families. And although we haven't done it, you can even code PCIs with coronary bypass grafting. One procedure that we commonly encountered, and you should remember, is this angioplasty. In the demonstration, you saw that they inserted the catheter with the balloon, deflated, and then they inflated it, and moved the plaque or occlusion out of the way. So this is a balloon angioplasty, and you're going to just see it referred to as angioplasty or PCTA. Another procedure that we saw was the stent. Yes, so in the presentation, you saw where they placed the catheter, and on the catheter was a balloon. They inflated the balloon, and then along with that inflation of the balloon was the inflation of the stent as well. Then they removed the balloon out and the stent remained in place. All right, so the last image is where the stent was remained in place. Here's another popular procedure, but we didn't really talk about it. This is an atherectomy. Atherectomy involves it's like they're cutting away the plaque from within the artery. So it's a lot more intense than the other two. So that's probably why it wasn't used as common, but it is common when you're coding percutaneous coronary intervention. When we use the term coronary therapeutic services and procedures, we are speaking about percutaneous coronary intervention. The doctor is intervening or providing some treatment to help restore the blood flow within the vessel. Code series 92920 through 92944. In our previous discussions, we've spoken about the common PCI procedures: angioplasty, atherectomy, and stents, but more often the angioplasty and the stents were discussed. These are common PCI procedures that go hand in hand with other cardiac procedures. Well, maybe not hand in hand, but they're carried out at the same time as other cardiac procedures. However, there are actually 7 common PCI procedures, and they're common when you're coding PCI only, percutaneous coronary intervention. One other point that I'd like to make before I leave the screen is that there are some bundled items in all PCI procedures. Those items are selective catheterization. The doctor is selecting where the catheter is ending. Transversing the lesion. Radiological supervision. Closure of the area. Arteriotomy. I have a hard time saying that. Arteriotomy. And image to document that the procedure has completed. And finally, diagnostic angiography. Now, we use these procedures, or we carry out percutaneous coronary intervention for the major coronary vessels or arteries. Also, the coronary artery branches, as well as coronary artery bypass grafts. Remember I told you that? Yes, so in a bypass graft, we can carry out these PCI procedures. And again, percutaneous coronary intervention is to help restore the blood flow. Due to occlusion, there could be some hardening or blockage in the artery. They could be clogged, whatever. They're trying to restore the blood flow. Okay, so in order to code PCI, we have to know what the major coronary arteries are. There are 5. So I will tell you what they are and try to show you where they are on this diagram, on this image. All right, so your major coronary arteries are the left anterior descending, the left circumflex, right coronary, left main, and ramus intermedius. Your ramus intermedius is often not found on many diagrams because it's actually behind the vessel, right between the left coronary and the left anterior descending. So these abbreviations are also HCPCS modifiers. So LD is for left anterior, LC is left circumflex, RC right coronary, LM left main, RI is ramus intermedius, and you will need to know and use these modifiers when you're coding major coronary vessels. So make sure that you document them on the pages of your codes. And just like the major coronary vessels, the branches have names too. The major vessel, its left anterior descending, has 2 diagonals. That's the name of its branches. The name of the left circumflex's branches are 2 marginal. Yeah, it has 2 marginal branches. And the major right coronary artery has the posterior descending and the posterolaterals. And there they are. So I've put them in yellow. And unfortunately, the left main have none, and the ramus intermedius, they both have none. But one thing that I want to point out, only the major vessels have modifiers. As you can see, I didn't list any modifiers for the branches. Okay, now that you know the coronary vessels, let's learn about the procedures performed in these vessels. All right, we know the most common procedures. The most common PCI procedures are the stent and angioplasty, and atherectomy is kind of in that category. However, there are 7 actual PCI procedures. Now, the others that I've mentioned are popular because they go hand in hand with other coronary procedures like the bypass graft. We've seen it in the aneurysms And, we just see them in everywhere. We even see them in coding vascular families, the subject that we just left. So those are the most common. So if you didn't study PCI, you wouldn't know about all of them. However, these procedures are all relevant when coding percutaneous coronary intervention. Now, the guideline tells you that there is a hierarchy of these procedures. And when you're coding, you need to know that revascularization for total occlusion or blockage of the vessel, that's 92943. That is your number one procedure. That is the most complex. And if you want to know what revascularization is, it means restoring blood flow. The number two procedure is revascularization for myocardial infarction. That's acute myocardial infarction. The code is 92941. The third procedure is atherectomy with stent placement, with or without angioplasty, and that code is 92933. The fourth is atherectomy with or without angioplasty, 92924. You saw me almost slip. Number 5, revascularization through a bypass graft. Yes, if the patient has a bypass graft, that can become clogged and intervention may be necessary. And that code is 92937. The sixth is a stent. Stent with or without angioplasty, 92928. And finally, number 7, angioplasty, 92929. And also, angioplasty is referred to as balloon angioplasty or PCTA. And these are your 7, and this is the hierarchy of the procedures. And if you're more of a numbers person and you want to see the actual hierarchy, it's as presented in the pink box. 92943 is first, but it is complexity-wise on the level of 92941 and 92933. 41 is second, 33 is third. Fourth is 92924, followed by 92937, who's on par with 92928, but they have to have a ranking, and it's number 6. And finally, we've got our angioplasty, 92920. So if that works for you, good. Now, some people might say, well, why is it important that they be ranked? Well, if you're going to code these procedures, the guideline tells you to code the most complex. Yeah, you got to code the most complex first. And also, some items are bundled in some of these procedures. You can see at 4, atherectomy is angioplasty is bundled right there. It's also bundled at number 3. It's also bundled at 6, so you wouldn't be coding them. So you code the most complex procedure. So that brings me to Chun. Chun is the greatest tool when you're taking your coding exams. If you just read your Chun, a lot of this stuff that I'm telling you, you'll see it. And yeah, Chun means your notations too. So without further ado, let's move on and let's take a look at my Chun page. Here is my Chun page. I kind of want to apologize because it's so blurry, but you know what? I think we can do it. The first thing I'm going to do is put my hierarchy. I'm going to list it. Number 1, revascularization for total occlusion or total blockage of that artery, revascularization for the acute myocardial infarction. Number 3, atherectomy with stent with or without angioplasty. Number 4, atherectomy with or without angioplasty. Number 5, revascularization for bypass grafting. Number 6, stent with or without angioplasty. And number 7, angioplasty. That's balloon angioplasty or PCTA. What I would do, I would just make only the necessary notations and place my FTRs at the bottom of this page along with my HCPCS modifiers for my major vessels, and that's it, because this can become too much. For me, less is best, but coders, you do have options. If you go to group study can give you some options on how to chun, and whatever speaks to you, let it speak to you. Let it flow. Okay, coders, let's get down to business. 92920, this is the code for angioplasty. 92924, this is the code for atherectomy. 92928, this is the code for stents. 92933, this is the code for atherectomy and stents. 92934, this is the code for revascularization within a bypass graft. 92941, this is revascularization with an acute myocardial infarction. 92943, this is the code for revascularization for total blockage of the artery. All right, so on the right, again, there's my hierarchy, and below, for now, I'm only listing my major vessels. These are the modifiers that you'll use when you're coding major vessels, and you're going to see why. We'll place the FTRs a little later because we haven't learned them. All right, coders, let's move on. And just like the major vessels, the branches have a hierarchy too. I'm not going to get too involved. If you'd like to read it, it's on the right. And just like you've done for the major vessels, you'll have to make note of this hierarchy as well. Although I wouldn't do it, you can pretty much read the code language, and that's what I suggest that you do. Also read the parenthetical guideline to code it properly. Okay, so we have a couple of more guidelines I'd like to show you. Now, this guideline reads, if a single lesion extends from one target vessel, so that's a major coronary vessel, and then it extends into another target vessel, then you just use one code. All right? So it's a single intervention and you use a single code. Now let me show you. All right, so let's say that the left main vessel has a lesion, and that lesion spans into the ramus intermedius. And this is the ramus intermedius, the one with the lines in it. Okay, it's right in between. And the doctor determines that one stent can be used. So the doctor just applies one stent. And you know what? You only use one code. Here you go. 92928 LM and RI modifiers. One code, and use the modifiers for the major vessel. So again, if there's one single lesion that extends the target vessel and one treatment is used, then use one code. And it's true, this guideline is true for any vessel, branch, or bypass graft. So let's say that this lesion is in the left anterior descending. Let's say it's right here. Left anterior descending, and it's also spanning into the diagonal branch. Well, the doctor would place the stent in both the left anterior descending, and the diagonal branch. And you know what? You would just use one code and one modifier. Remember, the branches don't have modifiers, only the major coronary vessels. All right, so we got one more guideline I'd like to talk to you about. Then we're going to learn about the FTARS. Bifurcation. Bifurcation means two vessels, two lesions, and two treatments. So the guideline says when bifurcation lesions are treated, both vessels are treated. So our scenario is that we've got a lesion in the left anterior descending and one in the diagonal. We're going to place a stent in the left anterior descending and one in the diagonal. And you know what? You got two codes. We're going to code it 92928 LD and 92929 for the branch. So the moral of the story, if you've got two treatments, you use two codes. You code them both. All right, so let's move on and learn the FTRs for coding percutaneous coronary intervention. Here are the FTRs for code series 92920 through 92944. Number 1, is this a main coronary vessel? Make sure that you know the main coronary vessels: left main, ramus intermedius, left circumflex, left anterior descending, and right main. What is the procedure? Revascularization, atherectomy, stent, or angioplasty? Code the highest ranking code for major vessels and add-on code for the branches. If one lesion spans a coronary vessel and if one treatment performed, use one code. Use two codes for bifurcation. Bifurcation means two lesions and two treatments. Diagnostic angiography is bundled. And coders, don't confuse angioplasty with angiography or angiography. This is pretty much your films, your x-rays. Make sure, this is a reminder, that to know the 5 major coronary vessels, and these all have modifiers. So if you want to list them on the bottom of your pages, I strongly recommend that you do it. And all of them have branches except the ramus intermedius and the left main. Ha! Okay, so here are your FTRs and coders. It's now time to code. So let's get started. A, 92941 LD, 92928 LC, 92928 RC, and 92920. B, 92941 LD, 92928 LC, 92928 LC. C, 92941 LD, 92924 LC, 92928 RC, and 92920. D, 92941 LD, 92924 LC, 92925 RC, and 92921 LD. A 57-year-old patient with total coronary artery occlusion arrives to the ED with an acute myocardial infarction. Percutaneous revascularization of the left anterior descending coronary artery was carried out. Intracoronary stents were placed on the left circumflex and right coronary arteries. Angioplasty was carried out on the left diagonal artery branch. What are the procedure codes for this encounter? Okay, coders, pause the presentation to solve. If you said A, outstanding. All right, coders, how did you solve this scenario? All right, first things first, let's highlight our keywords. 57-year-old, total coronary artery occlusion with acute myocardial infarction, had percutaneous revascularization of the left anterior descending coronary artery, and intracoronary stents were placed in the left circumflex and right coronary vessels. Angioplasty was carried out on the left diagonal artery branch. All right, that's a mouthful, so I don't want to get confused, and I don't certainly want to confuse you. So let's begin by answering the questions in our FTARS. Main vessel. Well, what is the main vessel? Well, you know what? We have three. We've got left anterior descending, we've got left circumflex, and right coronary. Now, the reason we need to know the order, the hierarchy of the procedures is because we need to know which one comes first, which one will sequence first. So we've got revascularization. We know that revascularization in the setting of a myocardial infarction, that's first of the procedures, of the PCI procedures, because of our chart. All right, so there it is, revascularization of the left anterior descending in the setting of a myocardial infarction. If you look to the right, you've got our hierarchy, and that tells you that acute myocardial infarction outranks everything else that was done that day. So if you look to the right of your screen, 92941, this is acute myocardial infarction. Well, I'll read the whole thing. It says percutaneous transluminal revascularization of acute, total, or subtotal occlusion during an acute myocardial infarction. Coronary artery or coronary artery bypass graft, any combination of intracoronary stent, atherectomy, and angioplasty, including aspiration thrombectomy when performed single vessel. All right, so another thing, coders, do you see how I annotated right outside of the code? And that keyword, acute myocardial infarction, just stood right out for me, and I went right to that code. All right, so I'm just pointing out the importance of documenting the procedures. All right, so we know that 92941 is a good code, and look, they all share that code, A, B, C, and D, and notice that the modifier is LD because the procedure took place in the left anterior descending coronary artery or vessel. All right, so what do we do next? All right, so, well, let's just go right in order. Right here, I see a 92928. This is a code, well, of course, we're going to keep that. This is a code for what? We can see it right away. Coronary stents. Were stents? Yeah, stents were placed. Stents were placed in the left circumflex and the right coronary. So absolutely, this is a good code, 92928. And look, LC is for left circumflex and RC is for right coronary. So that looks very good. Now let's look below at C. It's coding for 92924. And it's wrong because if you go to 92924, it's coding for an atherectomy. And we know an atherectomy was not carried out. So we're going to just go ahead and eliminate C and D. So we've got two options, A and B. And the difference between the two is the last code, 92920. All right, so what else could have taken place? Well, an angioplasty was carried out on the left diagonal artery branch. And if we look up 92920, this is percutaneous transluminal coronary angioplasty, single major coronary artery or branch. There you go. So we can code the first branch using 92920, and note there is no modifier coded for a branch. And if you got this correct, coders, outstanding. All right, coders, if I sound tired, that's an understatement. This was a long day. And you know what, coders? You're not finished. I have some more scenarios for you, and these scenarios are challenge questions. So go right ahead and solve these scenarios. Don't forget to pause the presentation. All right, I hope you enjoyed this discussion on PCI. If you want more, feel free to go to our website, www.amcicoding.com, and click on courses, and you can see all of these lectures. If you only want to see the lectures, click on courses and lectures. And since it is the month of love, at AMCI, we love our students and we love people who love us. So let's do this. If you respond in the discussion below, just give us some way to contact you. Respond in that discussion. Let us know that you're interested. And guess what? We're going to give away 3 lecture series. Yeah, so that means that you can see our lecture series and you'll be able to see them for 3 months for free. You can see all of the AMCI private lectures and that little video demonstration that you missed. If you want to see it, you can. All you have to do is respond in the discussion below. Let us know that you're interested in the free lecture series, and at the end of the month we're going to do a drawing, a public drawing, and we're going to draw out 3 names. And you know what, coders? I hope it's you. All right, so hopefully you had an outstanding experience. I know I did, and I look forward to seeing you next month.